Good morning, everyone. I'm joined today by Dr. Kieran Moore, Ontario's Chief Medical Officer of Health, and Matt Anderson, President and CEO of Ontario Health. I would like to thank both Dr. Moore and Matt for their partnership throughout the pandemic and their commitment to serving the people of Ontario. Earlier this month, the province reintroduced time-limited public health measures in response to the highly transmissible Omicron variant. At the time, we were facing an alarming increase in hospitalizations, unlike anything we had experienced during previous waves of the pandemic, with the number of new hospitalizations doubling every 7 days. Percent positivity was almost at 31.9%, nearly 10 times higher than when Omicron was first detected in our province. Omicron is testing health systems across the world, and our province is no different. Simply put, more action was needed to prevent our hospitals from becoming overwhelmed, particularly as our hospitals faced staff shortages due to the rapid spread of the virus. Ontario is fortunate to have world-class hospitals and frontline healthcare workers who for nearly 2 years have been steadfast in their commitment to providing high-quality care to both COVID-19 and non-COVID patients. I want to thank those individuals for their continued dedication and bravery during these truly unprecedented times. When our government announced the introduction of measures to blunt transmission of Omicron, we were clear that they were time-limited. We know that people and businesses need certainty on what the future looks like. And as the Premier mentioned yesterday, we will be providing more clarity later this week. As a first step, we want to be clear about some of the data we are using to inform the Chief Medical Officer of Health's recommendations and Cabinet deliberations. Ontarians should have the same understanding of the situation as government does, particularly in light of the situation and how quickly the situation has evolved with the Omicron variant. I'll let Dr. Moore and Matt speak to some of the details in a moment, but I want to assure Ontarians that we're starting to see glimmers of hope. The sacrifices you are making now have meant we are beginning to see signs of stabilization. Omicron cases are expected to peak this month, with a peak in hospitalizations and ICU admissions to follow. New hospitalizations are slowing and are now doubling closer to every 2 weeks. Experience in our hospitals has confirmed Omicron is not as severe as Delta, with far fewer patients requiring intensive care than in previous waves, despite much higher rates of transmission in the community. Over the coming days and weeks, we expect these trends to continue, giving us more confidence as we plan for what comes next. But I do want to be clear. February will continue to pose challenges, especially for our hospitals, as people continue to require care for COVID-19. But our goal has always been to ensure capacity is there to provide care for those who need it. Given current trends, we are increasingly confident in our ability to do so. Ontarians have also continued to make good use of this time by rolling up their sleeves, and we are leading the country in getting boosters into arms. Our government issued a call to action to get as many vaccines into arms as possible, and Team Ontario has answered that call. The capacity is in place and appointments are available for Ontarians who want to get their vaccines sooner. I continue to urge everyone to get their first, second, and booster shots as soon as they can. Another exciting positive step is the recent Health Canada approval of Paxlovid, an antiviral medication. We are expecting to receive very limited supply of just over 10,000 courses of treatment for January. We are working with Ontario Health to distribute this supply at a number of sites across the province as soon as it's received, helping to further protect our hospital capacity by prioritizing those at highest risk of severe outcomes. So I know that this has been a very long and difficult road for the people of Ontario. You have shown remarkable resolve in the face of considerable adversity. Each time you've risen to the challenge, and I have no doubt that you will do the same now. We will get through this together. Ontarians remain committed, as we always have, by taking a cautious and gradual approach guided by the evidence. Today, we want to provide some of the data that we are using to help inform the cautious approach that will guide us over the weeks ahead. Before I hand things over to Dr. Moore, I want to respond to some extremely concerning reports that some doctors are spreading misinformation about vaccines. At a time when it's never been more important for Ontarians to have confidence in the safety and effectiveness of vaccines, this is unacceptable. I will be sending a letter to the College of Physicians and Surgeons of Ontario, urging them to do everything that is possible to put an end to this behavior. They should consider all options in doing so, including reviewing the licenses of physicians found to be spreading misinformation. This behavior takes away from the unceasing efforts of the vast majority of physicians who are working to protect us all. I want all Ontarians to know that our vaccines are safe and effective. They're the best protection you have against COVID and Omicron. Please get vaccinated as soon as you're able. Thank you very much, and I will now turn things over to Dr. Moore.
Thank you, Minister Elliott, and good morning, everyone. Bonne journée à tous. As the Minister just indicated, the sacrifices Ontarians have been making are having an impact. I'm starting to have more hope and cautious optimism. For the first time in several weeks, the number of hospitalizations and cases in the intensive care unit is increasing at a slower pace. The severity of Omicron, coupled with the protection offered by vaccines, has meant that the length of stay for hospitalizations is now 5 days compared to 9 days for the Delta variant. We are also now starting to see our PCR test positivity stabilize between 20 and 25%. When considered alongside other data we track, such as capacity and length of stay in hospitals and ICU, this is an encouraging sign that we may be reaching the peak of Omicron transmission in Ontario in the coming weeks. While this gives me more hope, we must remain cautious and humble in the face of this aggressive virus. And the most important thing we can all do, as the Minister has said, is get vaccinated. Prevention is the key. With additional public health measures currently in place, our public health and healthcare partners have taken advantage of this time to get even more shots into arms. In just over 2 weeks, thank you to all of our vaccinators, over 150,000 Ontarians have received a first dose, and 1 million doses have been administered in total. More than 725,000 people have gotten their booster dose, and Ontario is leading the country in third doses administered. 5.7 million Ontarians have stepped up, come forward, and received their third doses. 77% of our over 70s are now protected better with their third doses. So thank you to all those that have come forward, and thank all the vaccinators across Ontario. Vaccines remain the best tool to protect ourselves against severe outcomes of COVID-19, including hospitalization and admission to intensive care. Currently, 50% of the individuals in the intensive care units across Ontario are unvaccinated, and yet the unvaccinated only make up 10% of our population. This alone demonstrates the positive protection that vaccination can provide against these severe outcomes. And the benefits of vaccination against severe outcomes have been shown across all age groups. That is why I continue to strongly encourage the parents of our youngest eligible Ontarians, those 5 to 11 years of age, to come forward and get their children vaccinated. Currently, and thankfully, 50.4% of children have received their first dose. But we want to see that number continue to climb and for parents to continue booking and coming for their second doses. The pediatric Pfizer vaccine for children is safe, it's effective, and it provides strong protection against COVID-19 and its variants. Boosters are incredibly important, and as a reminder, it's very important for those who are older in our community, who have any underlying medical disease, for our healthcare workers, and pregnant individuals, and those that are immunocompromised. It cannot be emphasized enough just how critical vaccination is to reducing our personal and community risk and to protecting our healthcare system. So thank you, Ontarians, for embracing vaccination and for making the sacrifices that you have over the last several weeks. Together, we've made an impact and we've made a difference. And together, these efforts will chart our path forward towards a safe and gradual reopening. We must stay cautious, we must stay disciplined, and never underestimate this virus as we look to take the small steps forward. Thank you, and I'll now pass it over to Matt Anderson.
All right, good morning. Thank you, Minister Elliott. Thank you, Dr. Moore. I'm going to take a few minutes just to provide a brief update on our health system and our capacity and some of the challenges of this wave. Overall, as you've already heard from the Minister and Dr. Moore, we are seeing some encouraging signs, but we remain in a very challenging environment and we're not out of the woods yet. Just to highlight a few of the measures that we're monitoring that do point to some hopeful signs. As you've heard from Dr. Moore, we're seeing relatively fewer people requiring intensive care. Over the last few weeks, the total ICU occupancy has remained relatively constant. Today, we have a total of 571 COVID-positive patients in our ICUs, compared to a high of just under 900 at the peak of Wave 3. We're also seeing that patients have a shorter length of stay in our ICU, and this is helping to limit the overall rise of the numbers in our ICUs. On the acute care side, where we have our biggest challenge, is in our ward beds or hospital beds. We currently have more than 4,100 COVID-positive patients in our hospitals. This is the highest total of hospitalizations we've seen throughout the pandemic. And over the last 7 days, fortunately, we are starting to see some slowing of that growth. As noted by Dr. Moore, it's still growing, but the rate that is growing each day seems to be slowing. These are encouraging signs. However, it's important to remember that even while with these key measures are trending in the right direction, we don't feel that in the hospitals. We don't realize these benefits for a number of more weeks. We still have hospitals that are under very challenging circumstances as we deal with these rising numbers. As the Minister has indicated, our health system will likely continue to experience challenges through February. A particular and unique challenge of this wave has been related to sick call as it relates to COVID in many of our healthcare settings. It's affecting all sectors and continues to add strain on the remaining staff. This includes our community care centers, our community support service, home care, and hospitals across the province. Primary care has also been affected. However, they continue to do amazing work to support our vaccination efforts, and we are seeing that they are continuing to try to grow their in-person supportive care. Thankfully, we are seeing some signs that absentee due to COVID may be stabilizing. We do have a number of agencies across the province saying that they're experiencing that they now have more staff coming back than are on sick call that day. An encouraging sign, but again, something we're going to have to watch. We continue to face pressures in some of our hotspot hospitals. We do have a number of hospitals that are operating at over 100% occupancy in their ward beds. Through our regional incident management systems, we have been transferring patients to try to load balance and to try to ensure a safe duty of care for all patients who are coming into, all people who are coming into our hospitals. Last week alone, we did over 100 transfers. In other waves, we are using the full resources of our provincial health system. This has been key to our efforts to ensure Ontarians get the care they need. We recognize that with the difficult decisions that we've had to make over the last few weeks, this has had a tremendous impact on all of us and on our families. Most of us, if not all of us, know someone who is waiting for care. These are difficult choices through this phase of the pandemic. Along with our ministry and government colleagues, we remain focused on addressing delayed care as soon as we possibly can. In closing, I just want to echo the minister's thanks to our healthcare workers. Our system has been under strain for almost 2 years now, and yet our front line has not wavered in their dedication and commitment to patients. Thank you to our healthcare providers across the entire healthcare system, our community care, primary care, long-term care, home care, and acute care hospital workers. All of you have continued to do your part to keep our system running and caring for patients. Thank you again for the opportunity to address you.
Operator, over to the first question, please.
Your first question comes from Allison Jones with the Canadian Press. Please go ahead.
Oh, hi, thanks very much. My first question is probably best put to Minister Elliott. We're hearing the message today, obviously, that there are some very early positive signs, some glimmers of hope. As you say that there's a positive announcement coming later this week on restrictions. Is that perhaps a little premature to talk about when schools are reopening this week, and that could potentially add another wrinkle to this? Could it possibly drive up transmission in a way that erases some of these gains?
Allison, I'm going to refer that question to Dr. Moore to speak about what challenges we're facing with the opening of schools, and nothing specific about what next steps we'll take, but just to speak about the issues you've just raised.
Hi, Alison. Thank you for that question. Well, I am excited to have schools open, and I hope all parents understand that we're opening them with as many layers of protection for the students as possible, including daily screening. The RAT test should be able to be distributed now that the schools are open after the snowstorms, and the masks that we've provided. So we have as many layers of protection as we can in the school setting to reduce the risk of transmission. We'll clearly be monitoring that situation. I am looking forward to the government announcement. I am confident that it will be phased, it will be gradual, it will be based on data, and it will follow the prudence that they've done in the past on that staged and phased reopening. We will continue, though, to monitor any risks of increased transmission in the community. As a measure, schools certainly haven't had a significant impact on transmission in the past, and I do believe the measures we put in place should minimize them as best we can as a society, and we've together made schools as safe as we can, and again, happy to have students back in the classroom for their mental, physical, social, and educational well-being.
Follow-up?
Yes, thanks. This is also for you, Dr. Moore. I had asked you last week about COVID deaths in the province, and unfortunately we've seen another very high number of deaths reported today, and I'm wondering if you're able to share any more information today on what's leading to this, whether it's still the tail end of Delta infections or if Omicron is driving this. Is this mostly, is it based on vaccination status? Is it based on age group? Is there anything more you can give us to help us understand what's happening?
Well, I applaud your question because I had the same questions myself, and we are continuing to work with all of our partners to get as best data to Ontarians as possible. So we're reviewing the death certification process. We're reviewing whether the death is causative or associated with COVID-19. We're trying to clarify if individuals have been vaccinated or not. Death, and I hate talking statistically about death. I know each individual is a member of someone's family, and I absolutely regret the deaths. But statistically, I do believe that a significant proportion of the deaths are related to Delta. As we all remember, we had that Delta rise at the end of December, and then Omicron took over. Delta is a much more severe pathogen, had a higher death rate associated with it, and we're seeking to clarify and differentiate Omicron versus Delta. So bear with us. These are often difficult elements to tease out across a health system to be able to give the best and most reliable data to Ontarians and decision makers. But if you ask me, I do believe that the vast majority are related to Delta because, as you know, someone gets admitted to hospital, then often they'll get transferred to the intensive care unit. Then if they deteriorate, they get intubated to be able to maintain oxygenation levels. And then they either pull through or, sadly, a significant proportion die. And that process often takes 4 to 6 weeks. And we're just trying to get you and all Ontarians better data in that regard.
Next question.
Your next question comes from Richard Southern with City News 680. Please go.
Hi, Minister. The Premier has said, and I think Dr. Moore kind of said the same thing, that we're going back to other levels of restrictions. It sounds to me like there's already a plan in place. Can you, number one, give us any idea what that plan is today? But number two, what data is this going to be based on? We haven't seen any data from schools because they just went back in session today. How can you make a decision, Minister, about lifting restrictions when we have seen no data from schools?
Well, we will have more to say about any movement with respect to restrictions later on this week. But I would say with respect to schools, we are very pleased that the students are going back for all the reasons indicated by Dr. Moore, and that there's very little evidence that there's high transmission just in schools themselves. We know that there's high levels of community transmission right now, but in schools themselves, as students go there, they have been made as safe as possible with the HEPA filters, with the number of rapid tests that are going into the schools, with the N95 masks being available for teachers and childcare workers. We are taking every step possible to make sure that when our students go safely back to school, that they will remain healthy.
Follow-up.
You mentioned masks, Minister. We've heard from a number of parents who say the masks provided to students don't fit correctly. I'm wondering if you can speak to how important a properly fitting mask is, number one. Number two, you say ICU occupancy has remained constant. I'm wondering if Dr. Moore can speak to if that has anything to do with the high death rate, 60 more Ontarians losing their lives to COVID today.
Okay, well, thank you. I'll refer that question to Dr. Moore then.
So the first question in regard to mask quality, the masks that we provided, the 3-ply masks to students across Ontario, are to provide an alternate for students if they want to use those masks. And you're absolutely right. A key component is that they fit well. So one would hope in the educational sector, they're helping students ensure that the masks are appropriately fitting. And all masks have to cover the nose right down to the chin. We should wash our hands before, wash our hands after. And it is the best fitting mask that all children should be wearing. So if that's a quality assurance issue that we have to follow up with, absolutely absolutely we will, in partnership with the Ministry of Education. In terms of the ICU, one of the most important markers that we've been following, and sadly you're absolutely right, a certain proportion do succumb to COVID-19, has been the length of stay. And the length of stay had a peak many months ago in the 20s, 20 days, which gave us an understanding of the complexity of care that some individuals required, and multi-organ failure that some individuals had, kidney failure and or bone marrow suppression and or liver injury. So now, though, we're seeing a much different picture. The length of stay is coming down. It's stabilizing at 6 and 7 days, which tells me we're providing the right care to the right Ontarians at the right time. And I do think with Omicron we'll see less lethality, that we're seeing that trend as we compare to previous waves, because the virulence is less, but some individuals still need intensive care services and mechanical ventilation, especially if they've got any underlying illnesses. And hence our mantra of, please, if you've got any underlying illness, no matter what age, 18 and above, please come forward and get your booster dose. It's very important as a marker of prevention against severe outcomes. So I hope that answered those two different questions.
Next question.
Your next question comes from Erica Vella with Global News. Please go ahead.
Thanks so much for taking my question. This question is for Dr. Moore. You've previously said that you wanted to see a plateau in terms of numbers. Is there a certain decrease or a number that we're looking to see within hospitalizations before really initiating that plan here in Ontario? And are you also planning on ramping up testing for that as well?
So it is a series of data points that we're watching. So a key metric is the total number of patients with causative admissions to the intensive care unit and or requiring mechanical ventilation, and their length of stay, and the total number of patients that are causative in hospital from COVID-19 and their length of stay, so that the ability of the healthcare system in Ontario to care for those that have the most severe illness. Those are key and important metrics. To also, we still have 55,000 Ontarians that are getting PCR tested every day, and thanks to all of those that are coming forward to our assessment centers, we're looking at the percentage of those tests that are positive. It went up to 30%, 31%. It's come now to the 20 to 25% range. So that's a marker of the percentage of tests that are positive. That's, again, another key metric. The other key metrics we're watching certainly is the healthcare capacity in Ontario. So we knew many workers would be absent due to themselves getting COVID-19, principally from the community, and we needed to ensure that all Ontarians would receive care at the right time, at the right place, by the right staff. And as Matt has mentioned to us, we're starting to see healthcare provider stabilize, and we are able to provide care despite 100% occupancy in some of our settings. And the number of outbreaks in particular in our long-term care sector is another key metric, because patients have to move across our system from the acute care sector to community hospitals and then often back to long-term care sectors. And the more facilities that are in outbreak, the more difficult it is to provide the right care at the right time. So I hope you're realizing it's not one number. It will be a judgment based on all of these different metrics by government of when to safely and cautiously reopen. And I do believe we've done so well in the past. And sometimes we've had to stabilize at one phase of the reopening and go longer. Sometimes we've gone a little shorter, but we've always followed the data. And I hope that I've given you a brief synopsis of some of the key metrics that we're following.
Follow up.
Thank you for that. My next question is for the Minister, for my colleague Kieran Lieberman. Minister, Ontario has pledged to provide N95 masks for education staff and rapid tests to staff and students. Will this be enough, coupled with other measures like the HEPA filters, to keep schools open during this latest wave?
Well, I will say that we've taken every step that is possible to protect our students and staff and daycare workers as well. Having the HEPA filters is really important. We're put in 700,000. We're adding another several thousand. We are distributing the rapid antigen tests to teachers and students so that they can monitor. These tests will be supplemented as time goes by. We've increased the number of cleaning and disinfecting processes that we're taking. So we're doing everything that we can to protect our students, because it is really important for their mental and physical health as well as their educational needs for them to be back in school.
Next question.
Your next question comes from John McGrath with TVO. Please go ahead.
Good morning, Minister and Dr. Moore. You've both repeatedly said that you're doing everything you can to protect students as they return to school, but I mean, that's not true, right? The COVID vaccinations are not mandatory for students the way they are for other vaccines. The Immunization of School Pupils Act has not been amended, and even if the government doesn't want to make that a general rule across the province, local MOHs who have asked for that power can't do anything until the government amends that regulation. They don't have the power to do that. So I'm wondering if the minister could explain why the government continues to tie local medical officers' hands and deny them this important public health tool.
Well, many parents are taking advantage of the fact that their children aged 5 to 11 can be vaccinated. We have over a 50% number of children that have been vaccinated with their first dose already, and more are coming forward. But with respect to the particular regulation, I will refer that to Dr. Moore, please.
I'll just remind once again that the Immunization of Student Pupils Act is not mandatory immunization. It's mandatory reporting of your immunization status. And in the ISPA, you must provide us with in public health for a set number of vaccines, whether your child is immunized. If you haven't had them immunized, we'll provide an educational module, or you can provide a medical exemption or some other type of objection based on religion or philosophy or beliefs. We don't have mandatory immunization policies in Ontario. We are working with our health units to ensure that they can get line listings electronically of the classroom. So if there is activity within a school, they'll know the immunization status, and they'll be able to provide advice to the school boards and to ensure that they have the data at their fingertips. Certainly, over time, we will be reviewing, as we do for all measures within the COVID, our policies, our protocols, and our procedures. But I do believe health units have tools at their disposal to be able to consult on a regular basis and support the opening of schools and have data as they need it.
Follow up.
In terms of the testing, both the positivity has come down a little bit, but the volume of tests conducted and the backlog are both down substantially from where they were several weeks ago. Pardon me if I missed something specific on this, but is the government intending to expand eligibility for PCR testing again?
Thank you for that question. So as of today, the report, we've been processing 53,000 tests a day. So thank you to all Ontarians that have gone to assessment centers and got it testing. Our turnaround time, we're still not perfectly happy with the turnaround time of 64% after 2 days. That's sometimes will slow down the ability of public health to respond to an outbreak or to a scenario to be able to minimize harm. So we're absolutely working on improving the turnaround time with that 53,000 tests a day. We had a high of 58,000 on January 7th. So the system is working in terms of being able to test those that meet the eligibility criteria. And as we've said before, we all have to remain flexible and adaptive. If we see an increased demand for certain populations to have access to PCR timing, we have to make sure it's timely, that it will enable rapid decision making by public health for treatments and or for isolation or quarantine in high-risk congregate settings, especially our long-term care facilities, our retirement homes, our shelters, and in our hospital sector. So those were our priorities. We have a framework by which we will approach opening eligibility for further PCR testing based on need, based on access for treatment treatment and based on high-risk populations. So we're working diligently, and thank you to all laboratories. They are having the same sickness calls that other agencies are happening. I know they're working diligently to try to process these tests as quickly and as efficiently as possible, and thank them for all their work. I know that our turnaround time will improve in the coming days, and it was a difficult beginning of January for most organizations and businesses across Ontario, and this clearly reflects it. So to summarize and to finally answer your question, we're absolutely reviewing all criteria on a regular basis of access to PCR and ensuring that people get the right test at the right time. I'm happy that we've given out 3.9 million RAT tests to parents of children, and that they can no longer have to do the drive down to an assessment center, have to wait for a PCR result, but can do the test in the quiet of their home with minimal travel time required, and have the answer within minutes. So thank parents for their patience as we distribute the RATs, and we will certainly, as the Minister has said, supplement those RATs with additional tests on a regular basis to ensure all parents and children have access to keep our schools safe.
Last question.
Your final question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hello, everyone. I'll direct this to Dr. Moore. Last Thursday, when you were asked about reopening, you said you couldn't guarantee that January 26th would be a good day to get rolling on it. Has your opinion on that date changed, or is there still some caution there about January 26th?
Hi, Robert. I do believe this is a government decision. The Premier, I believe, will be making a statement on this. We will be continually reviewing data to inform that decision, and I can't make any foreshadowing of that statement.
Follow-up, and this is the last question.
Okay, we all know it's a government decision, but we also all know that you're the one who makes the recommendation. So I asked you, what is your opinion of that date, and especially in light of the fact that most schools are getting back into in-class learning a little bit later than expected?
Well, I do think it's 2 weeks. That date is roughly 2 weeks after the start of school, even though with the snowstorm we'll have to be a little more cautious in monitoring. We're monitoring all pediatric admissions to hospital, all pediatric admissions to the intensive care unit. We're tracking that very closely, as well as the PCR test positivity in children to have a key metric of any increased transmission or risk within the school settings, and we'll be informing government of any trends in the coming days to enable them to make an informed decision on the reopening of Ontario.